Let's see about the radiological findings in cardiovascular system. It includes the X-ray findings. The first, in case of pericardial effusion, we will be having a water bottle or a money bag or leather bottle like appearance of the heart. It is seen in the AP view. In case of the lateral view, there will be a Oreo cookie like sign, that is the parietal pericardium and visceral pericardium, and in between we will be having this pericardial fluid, which is pericardial effusion. So in pericardial effusion, in AP view we will be seen as water bottle or the leather bottle or a money bag appearance. In lateral view it appears as an Oreo cookie sign. And in case of constrictive pericarditis, because of constriction of the heart, and it appears as the heart is placed in a cup, or it is also called the egg and cup, which is seen in case of constrictive pericarditis. And in case of Epstein anomaly or tricuspid, in Epstein anomaly we will be having this tricuspid atresia, so the heart appears like a box shaped. Normally there is the tricuspid valve in between this right atrium and right ventricle. In case of tricuspid atresia or Epstein anomaly, the tricuspid valve is placed much lower. So most of the part of left ventricle is occupied by the most of the parts of right ventricle is occupied by the right atrium. This is called the atrialization, and it is seen in the Epstein anomaly, so the heart appears like a box shaped heart. In case of Fallet's tetralogy, we will be having the foot shaped heart, and the components of Fallet's tetralogy is we will be having the right ventricular hypertrophy, and pulmonary stenosis will be there, along with ventricular septal defects and overriding of aorta. These are the components of Fallet's tetralogy. Because of this conditions, the heart appears like a boot-shaped heart. And moving on to the transposition of great arteries, it appears like a egg-on-side appearance. Normally, the aorta arises from the left ventricle and pulmonary artery arises from the right ventricle. In transposition of great arteries, these two great arteries get transposed and the aorta arises from the right ventricle, whereas the pulmonary artery arises from the left ventricle. And this leads to the appearance of egg-on-side appearance in chest X-ray. And in case of pulmonary artery hypertension, the pulmonary artery gets engorged and prominent, so it appears like a jug handle appearance seen during the chest X-ray. And in case of total anomalous pulmonary vein communication, it appears like a cottage leaf or snowman or the figure of 8 appearance. In this total anomalous pulmonary vein communication, the defect is with the opening of pulmonary vein. Usually the pulmonary vein opens at the left atrium. In case of this total anomalous pulmonary vein communication, the pulmonary vein crosses the heart and opens into the right atrium. So it appears like a encirclage of the heart, and that gives rise to the head appearance in case of snowman. So this gives rise to cottage bluff or a snowman or a figure of 8 appearance in case of total anomalous pulmonary vein communication. In case of emphysema, we will be seeing the tear-shaped heart. And in case of persistent truncus arteriosus, the truncus arteriosus should be closed after birth, but if it is persistent even after birth, then it leads to a sitting duck-shaped heart. Next, moving on to the endocardial cushion defect. In endocardial cushion defect, the heart will appear like a goose neck sign. This is the goose neck sign, and in the endocardial cushion defect, there is a defect with the development of the interventricular or the cavities are underdeveloped. So instead of the normal heart shape, it appears like a goose shaped heart. It is called the endocardial cushion defect and seen in the goose sign. And in case of coarctation of aorta, the aorta gets dilated, so it appears like a 3. So the sign of 3 is seen in the coarctation of aorta. In case of the ribs shows the Roseller sign. Roseller sign is seen in the ribs. It means the inferior border of the ribs got eroded due to the collateral arteries, and it is seen in the coarctation of aorta. So in coarctation of aorta, we will be seeing the 3-like appearance of the aorta, and the ribs appears with Roseller sign. And in case of partial anomalous pulmonary venous communication, there will be a Smitter sign. Smitter is a small sword. Smetter means a small spot, and this appears in the partial anomalous pulmonary venous return. And in case of carcinoid syndrome, the heart wall get calcified. So carcinoid, we will be having the calcified heart wall. When the ascending aorta gets calcified, it is seen during atherosclerosis. Atherosclerotic plaque accumulation may give rise to calcified ascending aorta, and it is also seen in syphilis. And in case of pulmonary artery hypertension, there will be a pruned tree of pulmonary vasculature seen. The tree without leaves is the pruned tree. So in case of pulmonary artery hypertension, we will be seeing this pruned tree appearance of the pulmonary vasculature in the lung fields. The lung fields will be having this pruned tree appearance.